Happy day, I'm Rekha Mahizhnan from the Department of Food Science and Management. Today's topic is medical nutrition therapy in diabetes. What is diabetes? Diabetes is a chronic metabolic disease characterized by persistently elevated blood sugar level, also known as hyperglycemia. It is a serious public health concern because it contributes significantly to morbidity and mortality. India is popularly known as the diabetic capital of the world. According to the National Family Survey conducted by Government of India in the year 2021, the prevalence of diabetes in India is 11.4%, while 15.3% of the population is in the pre-diabetic stage. However, the numbers are not uniform across the country. Tamil Nadu numbers are more concerning. The prevalence is 17.6%, which is higher than the national average. Urban areas show higher prevalence than rural areas, which could be contributed due to high stress levels, lower physical activity and poor dietary habits. On that note, now let us understand the importance of diet in diabetes. Before that, I would like to debunk certain myths. Which is more important and accurate, glycemic index or glycemic load? Is rice really the villain? Does it deserve such a bad rap? If you are diabetic, you probably know that glycemic index measure is a very important tool that everybody should know and understand. What is glycemic index? Glycemic index is a measure that describes the ability of a food to raise the blood sugar level after it is eaten. High glycemic foods are digested and absorbed very quickly and rapidly, therefore increasing the blood sugar level very drastically. Examples of high glycemic foods are white bread, white rice, sugary drinks and candy. Whereas low glycemic index foods are digested and absorbed very slowly. Therefore, it leads to a slow and gradual increase in the blood sugar level. Examples being legumes and fruits. Now, glycemic index is not that easy and simple. There are various other factors that could affect the glycemic index of food. First being nature of starch. There are two types of starches, one is amylose and the other one amylopectin. Foods containing high amount of amylose exhibit lower glycemic index. For example, basmati rice has a lower glycemic index when compared to white pony rice because of its high amylose content. Okay, next is degree of processing. Highly processed instant oats has a higher glycemic index when compared to traditionally processed steel cut oats. Similarly, highly refined wheat flour, that is maida, has a higher glycemic index when compared to whole wheat flour. Particle size does matter. Let me explain with an example. Wheat, when it is finely ground and made into a dosa, exhibits medium glycemic index of 61. Same wheat, when it is broken into grits and made into upma, exhibits even lower glycemic index of 51. When the wheat is converted into flakes and cooked, it exhibits a very high glycemic index of 71. So, this clearly illustrates that different particle size affects glycemic index differently. Let us move on to cooking methods. Some starch rich foods such as potatoes and rice, when they are cooked and cooled, they develop resistant starch. Resistant starch acts like fiber. Let me explain with an example. Ragi, when it is ground into powder and made into a porridge, exhibits very high glycemic index of 98. The same ragi, when it is cooked with rice grits and allowed to cool and ferment overnight and consumed as ragi kuru the very next day, it exhibits lower glycemic index. No wonder our traditional recipes such as ragi kuru and payasadam has become such a rage internationally, where they are bottled and sold as prebiotics and probiotics at an exorbitant price. Food composition matters. Food rich in fiber, protein and fat exhibit lower glycemic index. Similarly, foods rich in lactose, that is milk, and fructose, that is fruits, exhibit lower glycemic index when compared to refined white sugar. Maturity also matters. Potato, that is new, exhibits lower glycemic index when compared to the old and mature ones. Chew count is the most important factor to be considered by diabetics. The more time you take to chew food, the more time you spend at the table for a meal, better will be the glycemic control. So, it is important to spend at least 10 minutes at the table for a meal. Now, glycemic index does not tell you the whole story. What it does not tell you is how much exactly does the blood sugar rise when the food is actually eaten. To understand the complete effect of food on blood sugar level, it is important to know the quantity of sugar or carbohydrates present in that particular food. So, glycemic load, unlike glycemic index, take care of not just only the glycemic index, that is the quality, but also the quantity of carbohydrates that is present. So, if you take an apple that has 15 grams with a glycemic index of 40 and divide it by 100, it gives you a glycemic load of 6, which is considered very low. Therefore, a healthier option for diabetics. Let me give you another example. It is very evident that watermelon is a healthier option when compared to chocolates. But look at the glycemic index here. It is as high as 80, whereas chocolates, which is unhealthy, shows a medium glycemic index of 62. So, what the glycemic index does not take into consideration is the amount of sugar that is present. The sugar is as low as 6 grams, which reflects in the glycemic load, that is 5, which is low and considered to be healthy, whereas the sugar content in chocolates is as high as 40 grams, which reflects in the glycemic load of 25, which is very high and considered unhealthy. Therefore, it is safe to conclude that glycemic load is more accurate than the glycemic index. But what really matters is the context of the meal. We seldom eat rice alone. Although white rice is high in glycemic index, it can be brought down by throwing in some pulses and vegetables in the form of sambar and fat in the form of ghee. So, this would bring down the glycemic index and the glycemic load of the meal. So, what really matters at the end of the day is not the glycemic index or the glycemic load, it is the context of the meal that matters the most. Next, we move on to millets, the new superfoods. Is millets really superior to that of rice? Not necessarily when you consider glycemic index alone. We know by now when ragi is ground into powder and made into a porridge shows very high glycemic index of 98. So, this could be attributed to the low soluble dietary fiber content present in ragi, whereas other millets such as barnyard millet and little millet, which has high soluble dietary fiber, exhibits lower glycemic index. But if you are going to consider millets for its micronutrient content, it is definitely superior to the white ponni rice that we commonly consume. This table clearly shows that ragi is very rich in calcium and zinc, which is very important for diabetics. And millets like barnyard, little and brown top millets are very high in iron when compared to its counterpart rice, which has almost nil iron. Now, traditional rice has gained lot of popularity for all the right reasons. Some varieties of traditional rice like Kala Namak, Kauni, Kullakar, Karunkuravai, they all exhibit lower glycemic index when compared to the standard ponni rice. So, it is safe to conclude that not all millets in all forms have low glycemic index and not all rice varieties have high glycemic index. Therefore, it is important to eat both millet and rice in moderation. Finally, I would like to sum up the dietary recommendations. Total carbohydrate intake should be based on one's metabolic need, the type of insulin and medication that they are taking, and most importantly, personal preference. Recommended sources are whole grains, legumes, vegetables, fruits and milk products. Choosing low glycemic food over high glycemic food may modestly improve the glycemic control. It is important to include fiber rich food in the diet, especially resistant starch and soluble fiber. Dietary fat, saturated fat to be less than 10% of the total kilocalories. Take plenty of omega-3 fatty acids from fatty fish and plant sources such as flax seeds. Trans fat to be 0 or minimal. Cholesterol intake should be less than 300 milligram per day. Protein can be 1 gram per kilogram body weight, similar to the general population. Avoid high protein diet, especially diabetics with nephropathy, as it could harm the kidney. Finally, I would like to leave you with 3 golden rules for a happy and healthy living. Eat variety of food in moderation, have timely meals, include enough fiber in your diet. Happy eating. Hope you found this informative. For more such videos, like, share and subscribe M.O.P Classroom. Thank you.